just want to very quickly touch on CPAPs, and I want to make it very clear that we are not anti-CPAP. If you have a CPAP and you are benefiting from it, we want you to continue to use it. Now, I do have some patients where we kind of approach this more like a hybrid model or a combination model. And so sometimes I have people where we use CPAP primarily at home and it benefits them very well. And then we use the dental device when they're traveling or away from their normal environment, and it's just a little bit more convenient. So that can be a really great option for some people to kind of benefit from both therapies. Additionally, we have some people where they want to do CPAP, but the pressure on their machine is just a little bit too great, and so it becomes hard to wear it for extended periods of time. So in those situations, we can also do what's called combination therapy, where you're using your CPAP machine plus a dental device at the same time. And that can allow, in some situations, the pressure on the machine to drop by, upwards of 20 or 30%. And that can make it a little bit more tolerable for you to be able to wear your machine a little bit longer. Additionally, some people, they go to bed with CPAP, and then when they take their machine off, when they get up to go to the bathroom at 2 a.m, then they put the dental device on so they have some support for the second half of the night. It's important to note that there are, kind of different ways to fillet a fish, so to speak. And so you have to really kind of find the best route for you. But one thing that's also important to consider is that insurance is not always willing to pay for both therapies unless there's a really good justification for that. So as you're deciding about your treatment, it's important to have this, kind of a clear conversation with your care team and your provider to talk about, the best kind of sequence of CPAP, dental device, or combination of the two that's going to work for you and your lifestyle. Additionally, a lot of people ask me about Inspire, which is one of the surgical interventions for sleep apnea. And the way I like to think about that is it's kind of like a pacemaker for your tongue. So there is an implanted device in your chest that gets permanently implanted, and it wires up into the tongue nerve. And then when you go to bed, there is an electrical stimulation that gets sent to the tongue that kind of pushes the tongue out of the way. It's a very cool therapy, but there is some pretty specific criteria for who is a candidate and who is not a candidate for Inspire. Inspire is done by ear, nose, and throat doctors, and if you Google that, you can find a lot of information on the website to see if that is something for you. Again, like I've said in other videos, typically we would consider an Inspire, surgery option for people that are, not successful or not benefiting from the CPAP and the dental device.